So please feel free to still fill out the poll. We can close that window if you don't want to see it anymore. You've already filled it out. That's just for our purposes to know who are reaching and who are not reaching. As a reminder, if you missed anything from the last or previous roundtables, you can view all of these on YouTube. So we encourage you to do so. And in terms of our speakers today, it will be myself, Carolyn Davidson, the Vice President of State Engagement, and then I'm also joined by my colleagues, Leah Kaufman and Angad Buttar, who are our Directors of State Engagement. And we'll keep today's event short and sweet so that we leave plenty of time for questions. We'll start with brief reminders about the Atlas Facility Survey that's currently underway. Then we have some upcoming events and deadlines, the benefits of participating in the survey, and of course, a Q&A. And so if you have any questions, either now or during the event, certainly encourage you to put those in the chat. Our program coordinator for state engagement, Amelia Wilburn, will be monitoring the chat. So please feel free to reach out there. And with that, I'll turn it to my colleague, Leah.
Good afternoon, everyone. So if you haven't seen the email reminders, the survey is closing on January 28th. So please make sure that you leave time to complete it before then. As we've shared on past events, it takes about an hour and a half to complete the survey, but you might have to go to multiple people for information. So definitely don't wait until the last minute to do that. We have received over 1,100 responses so far. So thank you to those who've already done that. Definitely getting closer to our survey completion goals. Next slide. If you have more than 2 locations, you have likely heard about this already, but we wanted to reiterate that there is a streamlined submission process so that you don't have to complete all of your surveys individually. You do have until January 14th to let us know that you'd like to choose that option. And essentially what that does is if you have more than 2 locations, you'll be able to do a kind of a parent survey where you complete about 70% of the survey, and that, or I'm sorry, 70% of your survey responses can be transferred from that one parent survey to your other locations. So if your policies and procedures are the same across facilities, it makes a lot of sense and it will definitely save you time. You also have the option to do, if their policies and procedures were different for, say, outpatient versus your residential facilities, you could complete one for each of those types, and then we would transfer the information to the surveys that you would tell us to transfer it to. You do have to complete a little bit of the survey individually, but that's information that, such as staffing or handicap access, that will actually be different from facility to facility. So please email atlas@shatterproof.org if you haven't done this and you want to take us up on this option. Next slide. So we wanted to go through some of the frequently asked questions that we've been getting, and then there will be time at the end if your question's not addressed within these. But the first question, actually, I had an email about this today. Why do I get an error message when trying to submit my hours? So when you're putting your hours of operation in, the hours have to be provided in that hour, month format. You have to make sure that there's no space before or after, but where you put AM or PM. So let us know if you have any questions on that. Why can't I move on to the next page of my survey? Why am I getting an error message? The most common reason for this is that you haven't completed all of the questions, or that you haven't completed a required component. So sometimes there are different rows in an answer. So just go back and check that you have filled out all sections of each question. I did not receive my survey link. I think at this point, most of you who are on here probably do have your survey links. If you are a facility that has multiple locations and you haven't received a link for one of them, please don't assume that there's an automatic process for transferring information. If you would need to reach out to us to get either the individual link for a facility that you're missing, or to confirm that you do want to elect that streamlined reporting process. And then again, you will, if you have multiple surveys and you do the streamlined reporting, you're still going to have to finish each survey and have the attestation completed. And the atlas@shatterproof.org inbox is the best way to get to us if you are missing one of those survey links. How do I opt in to use your streamlined submission? So we talked about that. And then as far as facilities being disqualified, so there are some screening questions at the beginning of the Atlas survey. And that's just for us to make sure that you are eligible to be listed in Atlas. So recently I had a facility that had a very unique model who was disqualified from Atlas. We actually ended up adding them back in. So they're an outpatient facility that delivers care at a patient's home. And one of the ways that one of the screening questions is intended to weed out facilities that are telehealth only. They're not currently eligible for Atlas, although we're discussing how we'll move forward with that in the future. So they were weeded out, but they just contacted us at atlas@shatterproof.org, and we were able to put them back in and reopen their survey. So let us know if you have specific questions on those or issues with the screening questions, and you think that you are eligible, and we can address that on a case-by-case basis. I'm having trouble answering a survey question. So we have the Atlas Help Desk for this. Please feel free to reach out. You're also welcome to reach out to any of your state directors. Carolyn and Angad and I are happy to answer questions. So I think we talked about not receiving survey links. Again, you have all of our contact emails. You have the Atlas inbox. And then finally, why can't I submit my URL? Make sure that the front of your website address is this HTTP, the www format, and it should let you submit that. And then again, just make sure there's not a space before or after that address. There are a few more questions. Okay, can you confirm that you received my completed survey? We're always happy to do that. Again, you can reach out to Atlas or to your state director. And then finally, if you accidentally submit your survey, you can regain access to this, but what we'll have to do is go ahead and contact us at the Atlas inbox, and we can send you a PDF of your survey responses. And if there are changes to those before the survey closes, we can make those for you. We won't actually be able to reopen the survey once you've submitted it, but you'll still have a chance to make sure we have the right information before it's up on the website. And I think with that, I'm going to turn you over to Angad, who will talk about an event we have coming up.
Great. Thanks, Leah, and good afternoon, everyone. I hope everyone is having a great start to the new year. So if your organization is unsure about participating in Atlas, we have a CEO/senior leader roundtable that is taking place on Thursday, January 13th, 2022 from 10 to 11 a.m. Eastern Time. So this event will really focus on our treatment facility survey, and we'll have remarks from our founder and CEO, Gary Mendel. And we really want to take the opportunity to reach out to this audience and answer any questions that they might have, but also provide them with insight into Atlas and also where the platform is going later in this year also. You just, as you'll see in the chat, the registration information has been put in there, so feel free to send it to the appropriate personnel at your facilities. We're excited about the event and hoping that we have good, robust attendance. Next slide, please. So we're getting a lot of questions about what if I don't submit my survey, what will happen? So first, the facility profile will be incomplete and will be automatically filtered out of the search results. So that by way of saying the facility information, the name will show in Atlas, but as folks are conducting their searches, you can see the filter that's on the left-hand side of the screen where it says facility survey submitted, and that box is checked. So again, those facilities without facility profile and without having submitted the survey will automatically be filtered out. The second screenshot at the bottom shows that what will show under the facility's name. So the facility survey is not submitted, and it says the data has not been received, or I think it says incomplete. Sorry, the type is pretty small. So just wanted to point that out to folks We've heard some individuals say, well, I hear that my facility will still show an atlas if I don't submit the survey. So there is a clear delineation, as you can see in the 2 screenshots listed here. Next slide, please. So we took some time to really understand across 2021 just how many people were navigating and using Atlas. So over the entire year, Atlas was visited more than 86,000 times. And individuals conducted more than 11,000 searches as part of their search and treatment for a quality treatment. And then facilities were viewed more than 17,000 times across the entire year as well. So really humbled by that and excited to see that continue to grow as we are established in more states later on this year. So at this point, I will turn it over to my colleague, Amelia Wilburn, to help moderate the questions and answers. Thank you, everyone, for attending today.
Thank you, Angad. Yeah, if you guys want to just shout your questions out, that's totally fine. This is a safe space. Feel free to take yourself off of mute. And if you don't want to talk, feel free to put it in the chat and I will gladly read your questions out loud for you. So your preference.
While people are thinking, one question that I got recently was how should we fill out the survey if we have 2 programs at the same location? So if we have, say, a residential and an outpatient methadone, should we fill out 2 different surveys? And this is definitely something that we've heard before. You should fill out a single survey for all of the programs at a given location. So there are different questions that allow you to select if there are multiple levels of care offered at the facility. And we ask that you take advantage of that instead of filling out multiple surveys for a single physical location. So basically, if there is a door that's the entrance to your facility or the entrance to the suite, we count that as a location.
Hi there, this is Jennifer from Hazel and Betty Ford. Hi. So I worked with you on filling out our survey for Florida, which it was fabulous. Thank you for helping. And what I found out is that there's another person within our organization that worked on our New York one. So I was wondering, who do I connect with to make sure that I am the point of contact for both states that we are in, that Atlas is also in, and then for any future states that we both have?
Yeah, hi Jennifer. This is Leah. So I know we were emailing. So you're welcome to connect with me. And I think right now we do have you listed as the national person, but we can definitely double check that offline.
Okay, great. And it might be now versus when New York was, because we've had the New York one for a while. So I appreciate that. Thank you.
Sure. Yeah. And just for anybody else with questions, if you have facilities in multiple states, so we've been trying to refine our process for that so that there is typically one contact, although we expect that you will defer to individuals across states to help complete some of those questions. So just let us know how we can help you and, identify that key person and then have secondary contacts. Happy to do that.
Awesome. Thank you, Jennifer. So we have 2 questions in the chat, which I will read. So somebody asked, does listing Atlas on our website impact Google Legit Script certification? Google states we can only list Legit Script certified partners. I don't know, Carolyn, maybe if you have the answer for that one.
Sure, so I can dive in. So as many of you may know, you need Legit Script certification in order to appear in Google Ads. Basically when somebody searches on Google, being an Atlas does not impact that Legit Script certification. So if you are already Legit Script certified and you submit your data to Atlas, your ads will still appear on Legit Script on Google, and you'll still appear in Google searches. Atlas just adds another layer in that when you search your facility name, both whatever ads that you've paid for on Google or whatever Google search results normally appear will appear in addition to your Atlas facility profile.
Thank you, Carolyn. So we have one more in the chat. So somebody asked, I've been working on our different surveys, but the links are now leading to a blank web page that indicates the website has expired. Can we get our surveys back?
Hi, Emily, I can jump in. My name is Christine Mack. I'm the program coordinator on the data team, and I did see your email. I actually just emailed you back asking for the specific addresses to ensure that I'm getting into the correct links. My English is not great today, but thank you so much for emailing us at Atlas. The Atlas email, that is a great place to go for any data questions, and especially updates and things like that. So I look forward to connecting with you. Thank you for reaching out again.
Awesome. Thank you, Christine, for jumping in. So we have another data related question. So possibly Christine, if you want to jump in on this one, that's totally fine. So somebody asked, I have a second program location that is providing outpatient services with less hours per week than our primary location. How should I best proceed as I start our survey this week?
Oh, I realize I can jump in a little bit, but Christine, if you want to clarify. So because you have two locations, if you want, you can either fill out kind of the whole survey for each location, or you can fill out the survey for one location and have the majority of those data copied over to the other location. In either case, you are able to tailor the hours for each location in its specific survey. So you would start with the hours, the longer hours for one location, and then with the other location survey, you would go in and tailor the hours to be shorter.
Keep them coming, guys. These are really great questions. We're really glad that you're asking these too, because chances are that many other people have the same questions. So you can be the voice for many if you want to. So there's a follow-up question to the last question, which I think is really important to address also. So the person was asking about the second location. They mentioned they did not receive a survey invite for the second location. So yeah, Carolyn or Christine, if you want to jump in on what the process would be there to receive the second survey link.
Christine, I saw you nod, but I can jump in. So if you can reply to the original email that you got, or you can email us at atlas@shatterproof.org. And if you want to kind of expedite the process, if you include the address of the second location that you're missing the link for in your email, then we can search it right away. As Christine mentioned, when we get emails, usually our first question is, what is the address of the facility that you're referring to? Just because we know there are a lot of similar names of facilities out there. So we want to make sure we're talking about the right one. Yeah, you can email us with that address and we'll get it to you.
Thank you. I didn't get to my unmute button quick enough.
Awesome, thank you. And I was going to say also, you know, we do send a lot of emails out to you guys. Always feel free to hit reply. We have real people monitoring the Atlas inbox all day long, so we will always get back to you within 48 hours. So if you see something like that and you see, oh, you know, you guys listed one facility, I actually have 5, just hit reply and we can absolutely work with you to go through that. We also have a help desk, which are in office hours as well. So if an email is not going to do it for you and you want to meet with us face to face, we absolutely love to do that. And I can provide the link for that as well. I just thought I didn't provide the link. I'll do that right now.
And while Amelia's putting that link in, I'll just note some key takeaways from this event. So if you need to remember, you know, one slide, if you want to screenshot it, that's totally fine. We'll also be sending out the slides and the recording afterwards. But just as a reminder, complete the survey before the deadline of January 28th at 11:59 p.m. Central. If you're eligible, let us know that you want to do a streamlined submission of the survey. So if you have at least 2 locations, you're eligible. And then also, if you have not registered yet, please register for the Senior Leadership Roundtable, have your senior leader register, and then share the link itself. And if you've taken a screenshot of that slide, just a reminder that you can also always reach out to your state engagement director. So Leah Ongud and I, you see here the states that we oversee, but truly there are no wrong doors. If you email one of us and you don't have the right state for some reason, we will connect you to the right person.
Also, if you think of your question later, again, go ahead and send it to the Atlas inbox, atlas@shatterproof.org, and myself or someone else will get back to you. So if something pops into your head later on in the day, you're like, oh, Atlas, send us an email.
And with that silence, we will end early, give you back a half hour of your time. If you have other questions that you'd like to ask, you can message us in the chat or unmute yourselves. Otherwise, we